AIDS. What is AIDS? AIDS stands for Acquired Immune Deficiency Syndrome. It is a disease caused by the development of HIV. It is a severe loss of the body's cellular immunity or immune system which lowers the resistance to infection. It was first discovered in the USA in the 1980s. What is HIV? HIV stands for Human Immunodeficiency Virus. HIV kills white blood cells which are used to fight infection. These cells are also known as CD4 cells or T cells. If you have HIV, virus levels go up and CD4 cell levels go down. Certain body fluids from an HIV infected person can transmit the virus. These fluids include some of the following: blood transfusion, semen, vaginal fluids, breast milk, and menstrual blood. How big an effect does it have globally? AIDS is so serious globally that the US has considered it a threat to national security. The worst affected region is sub-Saharan Africa, where in a few countries more than 1 in 5 adults is infected with HIV. How big an effect does AIDS have in New Zealand? In New Zealand, the early epidemic of HIV infection and AIDS was commonly concentrated among men who had sex with men. They're still the group most at risk of catching HIV in New Zealand. How can it be stopped? There is no cure for AIDS, but you can prevent yourself from getting it at the stage of HIV by not having unprotected sex, covering cuts or breaks in the skin with bandages, and avoiding multiple sexual partners, like prostitutes. In 1987, a drug called AZT became the first approved treatment for HIV. What was the Berlin patient? The first Berlin patient was anonymous, but the second patient was named as Timothy Ray Brown. The Berlin patients received a similar treatment to that of cancer. A bone marrow transplant was taken from a donor with a rare double mutation of the CCR5 gene that HIV uses as a gateway to infect and develop. The doctor performing the procedure will then induce chemotherapy on the patient. This is the end of the AIDS project by Alec, Hart and Sam Waller.